Welcome to Rainier Avenue Radio World. It's me, your host, Tony B. This is our special broadcast of the impacts of the coronavirus on South Seattle and surrounding communities. Welcome. And again, this thing keeps shifting and changing, and the landscape keeps evolving and moving, but we're still here. We know now that we're certainly going to be living with this thing for a while, and we will continue to bring you these impacts of the coronavirus on South Seattle and surrounding communities. This show began on March 13th of 2020. We're here every Friday from 1 to 3 to give you information on what's taking place from a number of different perspectives, whether it be talking to community members, government officials, health professionals, small business owners. We get childcare providers, whatever it is, we try to bring you the perspectives of our community. Joining me on the show this morning will be Dr. Umair Shah, the Secretary of Health for Washington State. He'll be here. We're going to talk about the mandates, the vaccine mandates that are either going to be in place or will be in place, or they're getting moved. We're going to talk about all that stuff in regards to vaccine mandates. And also joining me later on the program will be Belinda Dunbar and Glenn Turner from the Emergency Feeding Program. And Emergency Feeding Program just does amazing things in our community, a Black-owned provider of food to our communities, and love to share their story, hear their story. And they've also got a fundraiser coming up. So we're going to talk with Belinda and Glenn and share more information about the Emergency Feeding Program, how you can help. Yes, as the coronavirus moves forward and more of the emphasis is placed on the Delta variant and the various strains that might replicate, people haven't stopped being hungry. And as a matter of fact, as we move into the fall and people move indoors, looking at a recession, the need for the services that Emergency Food Feeding Program provides are, again, not that they ever stopped, but again, people need to eat, and just a great program that they have there. It's time for the impacts of the coronavirus on South Seattle and surrounding communities, and I'd like to welcome again to the program Dr. Umair Shah, and I want to make sure I'm saying your name correctly, Dr. Shah. Did I get that right?
You did. I hope you're doing well, Tony B. Did I get yours right?
You know what? As they say, you call me whatever you want, just don't call me late for dinner. That's never miss an opportunity to use an old joke. That's my motto.
No worries. Great to be here.
Let's start off with this, Dr. Shah. How are you doing, you personally?
Well, thanks for asking. It's been tough. As you know, I'm a doc. I'm Secretary of Health, but I'm also making a lot of transitions in the meantime. Governor got me to join his cabinet back in December. I left Texas, Houston, after 25 years. It's a long way from home. It's a big time difference, Texas to Washington. And, my wife is now, I was commuting back and forth to Houston and Washington. Now she's commuting back to Houston. And our kids are now here, and got our family here. Our puppy is here too. So we're doing better, but it's been tough during the pandemic as well.
Yeah. What do you think about Washington?
Well, I like it. It's different. I'll tell you. Heat, humidity, mosquitoes, hurricanes, things that I was dealing with all those decades down there, and coming up here, and the weather's been fantastic. Although it got a little hot, as you know, a lot hot in the summer. And then certainly people are telling me that it never rains here. So I believe them, because since I've been here, it's been sunny. So, I'm feeling pretty good. And people have been just incredibly warm and welcoming. But I'll tell you, Tony B, it's a tough time. And, it just shows the resilience of people, including during these difficult times. And obviously we want to do everything we can to get people through this challenging time for everyone.
as simply as you can, so that someone like me can understand. You got a lot of titles. What is it that you do? Explain to us, as the Secretary of Health for the state of Washington, what essentially you are assigned to do. Your job, not the big job description with all the $25 words, but just tell us what you do.
Yeah, well, I was appointed by the governor to be part of the cabinet, and so I always like to say that I start with being a doc and I end with being a doc. That's really key. But and I'm the first Secretary of Health that is a physician, and so that helps with knowing what's happening in the healthcare system and obviously what's happening across our public health system in Washington. But really, it's leading our state health department, which has been tirelessly working for a year and a half plus, day, night, weekends, holidays, an incredible amount of professionals doing just incredible work. And sometimes, hearing a lot of criticism about that work, and yet they persevere. So what I do is I lead that effort. And one of the things that I've done over my career has been, obviously, as an emergency department physician at the VA hospital in Houston for 20 years, taking care of our nation's veterans. And then also lots of crises, from Tropical Storm Allison to Hurricanes Katrina, Rita, Ike, Harvey, and then name it, H1N1, Ebola, Zika, chemical fires, and black plumes over Houston, all sorts of things. So all of that, and now you're in territory that we've really, none of us have seen for a century, for 100 years, has been COVID-19 and this pandemic. And so it's really been fighting this pandemic, and that's been something that we've been really focused on, super focused on. So what I do is really right now has been leading the efforts against this pandemic in our state.
And Dr. Shaw, welcome to Rainier Avenue Radio. And we have open, honest, and frank conversation here. What we do unashamedly is represent the members of our community. Depending on where you get your information from, the most diverse community in the country. And as we know, we were not and are still not all experiencing this pandemic in the same way. As we know, it's Black folks, brown folks, in particular, again, Black folks and Pacific Islanders, and that are bearing the brunt of the hardship of this pandemic. You can differ with me if you want to, but I'm telling you what's happening in our community. And this was happening before it became mainstream media news. Again, there was a lot of misinformation and disinformation that was out there. And you add on to that a general lack of trust because of the government, because of historically what the government has done to folks in our communities. And so now we have a raging pandemic that is killing people in the hundreds of thousands. And the message keeps changing. And so that's what we want to talk about today.
Yeah. Let's do it.
There was a mandate on August 9th, and then there was another for vaccines and being vaccinated. There was another mandate on the 20th. To be honest with you, I don't know if there's even been another mandate. I know that we've shifted again, at least in King County and Seattle, the housing situation, the eviction moratorium, and it's just hard to keep track of all this stuff. And I'm glad that you're here. Thank you. This is the first time that we've actually heard directly from someone associated with the governor's office. So let's start with this, a mandate to get vaccinations. Start from the very beginning. What is that about, and why did that become something that the governor mandated, and who does that mandate apply to?
Yeah, thanks for asking. So first of all, I want to address something else that you said before I jump to that question. There's something even deeper than that, which is you said that communities that have been impacted disproportionately, more so than other communities. That's absolutely right. That's not just a Washington phenomenon. That is a national phenomenon. That's actually a global phenomenon. And we know that Black and brown communities, communities of color, communities that don't have resources, communities that have been stigmatized, that have been put off to the side, that have been marginalized, that have been not with the power dynamics, do not have the resources, have not been given the resources, have not been able to be empowered, have not had empowerment. In many ways, really that, as you know, predates COVID-19. That did not start the moment we had our first case in the continental United States in Snohomish County. That started decades ago, and some would say centuries ago. But I would say that it is well prior to COVID-19. The problem is that COVID-19 has now added to it. And in fact, it's unearthed many of those real socioeconomic issues that have now made it even harder for people. And so when we say build back better, oh gosh, it's not even about build back better. It's about really, truly building. We've got to start from a lot of places that have just not had. And so the devastation that has occurred across our nation is something that all of us should be concerned about.
Well,
so I wanted to,
part of the problem is what you're talking about. A lot of people would say that wasn't the case, that we were living in a post-racial society. And I think I hear you saying, oh, it's been going on, but for a lot of people, they didn't believe that was the case. And what the pandemic did was expose the reality of the holes in our safety net. So we know as communities that these things have been taking place. What the pandemic did for most folks was expose the reality of it. That's there. And again, you can disagree with that as well. But in regard to the vaccine mandate, tell us what that's about, why that's in place, and who are the folks who are mandated to get vaccines?
Yeah, so the governor made it very clear that, look, we've got to get people vaccinated because that's our way out of this pandemic. He made that very clear, and we've made that very clear from the beginning of this whole vaccine process. And so we've done everything we could, from encouraging to, incentives to everything you can think of. So what the vaccine requirements are, where the governor felt very strongly where he had the ability to require vaccines, which included for individuals that were part of state government, most state workers, health care workers. And the reason there that he didn't want to see, and we didn't want to see, and as a doc, I don't want to see anybody who gets sick because I, as a doc, am somehow passing along a COVID infection to my patient, the very people that we're caring for. And then the requirements within K through 12 in schools for the adults in the school. Obviously, you've got kids who are eligible for vaccine from 12 and up. By the way, my daughter is now 12 and up, so just turned 12 a week and a half ago, and she got vaccinated her first dose. So woo! But adults, also the faculty, the staff within the schools, and the requirements are that they all must be vaccinated unless they have a religious or other deeply held religious or medical exemption by October 18th. And that is the condition of employment as per what the governor's requirements are.
So just let me make sure I understand here. Healthcare workers, healthcare professionals, nurses, administrative staff.
That's right. So really it's about individuals that are going to have patient care activities, but that's where the focus is, but it really is beyond that as well. So you're going to have folks who are obviously part of that healthcare ecosystem that would also be required to get vaccinated.
And did I also hear you say public school educators, teachers?
That's right.
Okay, and does that
and custodial staff? I mean, we're talking about, again, the adults in that area, not just the people that are in the classroom. And Tony B, I think that the reason let's kind of zoom up a couple levels here. The reason is that we're trying to fight this we're trying to end this pandemic, right? We're not just trying to skate by and do something that's going to allow us to continue in this for like years and years and years. We're trying to end this. And how do you end this? And if you go back a year and a half ago, when this pandemic first rolled out, all of us said, gosh, if we just had a way to finish this, end this. And the promise of vaccines was the way to do that. But when you now have our hospital systems that are in crisis, when you have healthcare workers who are in such difficult places that they don't even want to come to work or can't come to work because they are seeing a fifth surge that we have had in our state. And now they're looking at that and saying, what can we do to prevent it? Well, there are things we can do. We can mask up and we can have policies. We can have all sorts of things, stay out of crowds and social distance. But the way out of this is vaccines. And that's why vaccines are so critical to the path forward. That's the rationale behind what we're trying to do.
Okay. And not everybody agrees with that.
I hear you.
Not everybody agrees with that. I'm not debating whether that's the case or not. I'm vaccinated. I got my shot early. And
great.
We see where we're at now. I think it's 95% of the folks who are dying from coronavirus, the Delta variant, are unvaccinated people. So those facts are out there. But again, the vaccine mandate, for whatever reasons people have, strikes some folks the wrong way. What I'm trying to get at is the people who have to be vaccinated, and just clarifying who those folks are. If they choose not to get vaccinated, what happens to those educational workers and teachers and staff and all those folks, the nurses, the janitors, what happens if they choose not to get vaccinated?
No, obviously, first of all, we hope that they do not choose make that choice. We hope that they get vaccinated. As I mentioned, the two exemptions that are in place for deeply held religious views, as well as for medical exemptions, that is something that obviously is important. And as you know, and you've heard, and you've read that the state has also been in negotiations with unions, and that's also another piece of this. But really, the way this was initially laid out, and obviously there have been some modifications to it, but initially laid out was that by October 18th, you would have had to be fully vaccinated, which that would mean that either one dose of the Johnson & Johnson vaccine or 2 doses of Moderna or Pfizer. And if by October 18th, unless you had those exemptions or pending any of those continued conversations and negotiations with the unions and other pieces of this whole ecosystem, the puzzle, if you will, that it would be that you would potentially lose your position. It was a condition of employment. Now, I want to make it very clear, we don't want anybody to lose their job. This is already hard on people. We do not want that to happen. But we feel also very strongly about the importance of vaccinations. And so this is where you have two very important issues that are coming to tension. And this is where we as the state have landed.
And so the people who choose not to get vaccinated, they lose their jobs.
That would be correct. As I said, don't want anybody to be in that position.
And so do they get unemployment?
That's a good one. I will tell you, it depends on some other factors that probably I'm probably not the best to speak on, but I will say that's the key issue right now, is working through all of those kinds of what's going to happen with those individuals, or those people who decide not to get their vaccine. Some will seek to choose other employment. Some will, lose their jobs because they've decided not to get vaccinated and not go elsewhere. Others may be exempted. And then certainly the continued conversations about some who may start the process but not be fully vaccinated by that timeline. So there's a lot of things that are still in process, if you will. But I think the key message is we don't want anybody to lose their job. We don't want anybody to be in a situation that's going to cause either harm for the people that they take care of, or themselves, or certainly their livelihood. We want everybody to be able to be safe and protected.
Yep. And Dr. Shaw, respectfully, I do understand that. But my question is, and if there's no answer to it, there's no answer to it. You lose your job, and at that point, it's a gray area whether you will get unemployment or not. So if you choose not to get vaccinated, there's a potential domino effect of potentially, not being able to pay your rent, not being able to do what you need to do for your children. And we don't know yet if those folks are going to get unemployment. Is that a gray area, or we just don't know? Or
well, it's just you're asking me. I'm not sure. I can give you that answer. But I can certainly get that for you if that would be helpful to get that. I know that our legal teams were talking about that, and certainly the employment side of the house has been having those conversations. I've been trying to focus, as you can imagine, on the vaccine side of where we are with things as well.
Yeah, that again, we know the domino effect that coronavirus has had on every aspect, so it's all related.
It is
to what we're doing. So we know again that Black folks, Pacific Islander folks, marginalized communities are less likely to have been vaccinated for whatever reasons. How do you care for the fact that, whether it's perspective or reality, this is going to also disproportionately affect folks of color who are choosing not to get the vaccine for whatever reason? Again, you can tell me what you think about this, then they are also going to be disproportionately impacted and affected by the loss of their jobs.
Yeah, so I'm not sure I would say absolutely that it's only Blacks or Latinos or Asian Americans or Pacific Islanders. I mean, we're also, obviously, this requirement is across the state. And, there are in other communities also. I mean, I think the commonality is economic resources, and that's the key.
I know, but I focus on our communities.
Sure.
That's what I focus on, so that we can get the answers that we want, because often we don't get those answers.
Mm-hmm.
And so, again, the question is, if it's going to be unilateral, we know that some communities have been impacted more, and if that's the case, the likelihood that those are the communities that are going to be impacted by the loss of jobs. What are your thoughts on that? Have you prepared for that, or again, are you saying, well, it's not certain, because we've been through this before? We knew what was happening to us when they were saying it wasn't happening to us. So that's what I'm asking. It could be perception. I've been told by one of our county officials that, well, I can't concern myself with perception. Perception affects and impacts us. So, but if that's what's going to happen, or have y'all thought about, okay, there is a mandate, and we get why. I'm not disputing that. But this could disproportionately affect people of color. And if they don't get unemployment, or you're not sure, that's what I'm getting at. Have you thought about this, or what is the plan? Because this could turn into an equity issue. And I think the point that we're trying to do is get ahead of these things, not be behind the 8 ball.
Mm-hmm, mm-hmm. No, I think you're right. I mean, I think there is absolutely the concern that all of us have, which is about all community members in not just everywhere in the state, but obviously the people that are listening to this show now, we're concerned about that. We're always concerned about that. That's been throughout, that it's not just a pandemic that's been about health and medical. It's also been about the socioeconomic impacts on communities, and communities that have been impacted, disproportionately impacted, communities of color, for example. So yeah, I hear you and I agree with you. What I also would say is at the same time that an individual who gets sick from COVID-19 also there's an economic impact to that. When somebody gets hospitalized, there's an economic impact to that. When somebody dies, there is an economic impact to that. It is a family impact. It's a social impact. It's a community impact. We have to keep that in mind as well. So when we talk about socioeconomic consequences, we only bring it into one side of the house, but we don't think about the ramifications when people don't do the kinds of things that are going to protect them from this kind of a pandemic. I'm not saying I can force it or require it. That's not the issue in my mind. My issue is I'm a physician. I'm coming at it from when you are sick, you cannot help your family. When you are sick, you can potentially infect somebody else. When you are sick, you could get hospitalized. When you are hospitalized, you could have a worse outcome. Those are the kinds of things that I, as a physician, have spent my entire career in preventing. And so I want to make sure that if we're going to have that kind of a conversation, we have the conversation on both sides of that, because that is also equally important.
And Dr. Shaw, I appreciate you coming, and I knew it wasn't going to be a lot of time because there's so much to talk about, and this is very nuanced. There's some other stuff, but I had to get some answers to that, and now here we are almost out of time. But so which state workers does this mandate impact? If you're a subcontractor, for example, in the healthcare field or in the educational field, did the mandate still apply to you if you teach after-school classes? Any association with the healthcare industry or any association with the education industry means you got to get vaccinated? Or?
Yeah, it applies to state workers, most state workers, obviously the ones that are part of the executive branch. What I mean by that is somebody is an independently elected official. They can make a decision if they want to move forward, and many have. For example, the Attorney General Bob Ferguson also had that kind of requirement in place for his workers, but he didn't have to, and that's not under the governor's purview. But I would also say that it does apply for contractors as well. And so it really is, we're trying to do everything we can to encourage and incentivize people to get vaccinated. I think that's the bottom line.
Okay. And how do you get proof of vaccination? Might seem like, a pretty simple question, but there are folks out there who may be going, I don't even have my card. I got vaccinated at a pop-up location. I don't know how to navigate what are they looking for? What is acceptable proof of vaccination, for one? And then how do you get this proof of vaccination?
Yeah. So one is your card, right? Your card actually is proof. So every time you get vaccinated, you get it listed that you've been vaccinated. That card, hold on to it. Some people have laminated it. Obviously, if you have to add an additional dose or a booster or something, then you got to think about that when you get it permanently laminated, for example. But that could be proof. The other proof is that you can actually go to our Department of Health website and actually get into your record to be able to actually get a document that says that I've been vaccinated, or I've gotten fully vaccinated. And the other is you can keep a copy of that record on your phone if you have it, or if you don't want to carry it around, you can have some proof with it. And then some places, including in King County, that's going to be happening, and certainly in private sector, you've heard with the Seahawks and the Kraken and others, that there is a verification process that they would have as well. So there is possibility that a private sector might have a way to do to be able to check. And then we're certainly at the state looking at some strategies that might allow us to help people be able to get verified that they've been vaccinated as well. So a number of different modalities.
Okay. And I just want to make this real clear for folks who have lost the vaccination card, or when they initially got it back in May, said, I'm not going to need this thing. You can go to the Department of Health, and you may not be the IT person, but sometimes these things can be challenging to navigate. But if you do know how that, will you go to the Department of Health website and then do what?
Yeah, and there's a COVID vaccine page you can go to, but there's also 1-833-VAX-HELP. You can also call 1-833-VAX-HELP. VAXHELP, and that will also get you to a live person that can also walk you through the process. You don't have to rely on going on the website. You can call someone as well. You can also call your local health department. There, health departments across the country, obviously King County, as well as in Pierce County. There are, places where you can go and also get your vaccine record, or get information on how to get your vaccine record so that you have it in front of you.
Well, here's the deal. Whether you like it or not, whether you agree or disagree, it's happening. It's coming. So folks can take it from there. Dr. Shaw, I appreciate you taking the time to come on and answer some questions and share information with us. But I do want to give you the opportunity for final words here for a minute or so. If there's something that you want to say to our community members.
Yeah, Tony B, first of all, thank you. And I hope we have more time to do this again. I'm always willing to talk. I'm always willing to connect and engage. And this has been a tough time for everyone. This has been a tough time for my family. It's been a tough time for your family. It's been a tough time for everybody who's listening right now. And look, vaccines are so critical. But right now, we're going through an incredible surge with this Delta wave. Hospitals are really stretched. They're strained. They're stressed. We have staff shortage. We have a lot of things going on right now. And what I would say the key message is, please help us. Mask up, stay out of crowds if you don't have to be, Make sure you do everything you can to get vaccinated and champion vaccines for other people. Do the things that ultimately are going to help all of us get out of this pandemic. And that's what we're trying to get focused on. So thank you, Tony B. I'd love to come back and really hope this helps. And please, 1-833-VAX-HELP if you're trying to get more information on how you can get your vaccine records and other information on our website.
Thanks, Dr. Shaw. Appreciate you coming here. And I finally got somebody from the governor's office. So it took 18 months, but I appreciate it. And thank you for your willingness to be here, answer the questions. And yes, I will be asking you to come back because there was more. And at the end of the day, again, I think that the goal that we all have is to make sure that our communities are aware. And if it takes, whatever it takes to make that happen, then that's what we're going to do. Thanks for being here. You
got it. Thanks so much, Tony B.
Yep. Coming up next, we're going to be talking to the emergency feeding program. And joining us again will be Glenn Turner, and Belinda will be here as well. They have a fundraiser coming up that I'm excited to be able to talk about, your opportunity to assist and help them because they do so much for our community. So when we get back, my guests will be Belinda Dunbar and Glenn Turner from the emergency feeding program right after this. Welcome back to Rainier Avenue Radio World. It's me, Tony B., your host of the impacts of the coronavirus on South Seattle and surrounding communities. Last year, we didn't have the Earshot Jazz Festival, so excited to get that back in whatever hybrid form it does take place this year. Again, the landscape keeps changing, so who knows what's going to happen. I do know that mental health is also important, and so as we work our way through this pandemic and the variants and surges and all the other political things that have now become part of this process, folks still want to have a good time, and there are folks out there who make their living in the entertainment industry. So I'm trying to figure this out. Right now, I have my guest from the emergency feeding program, and really excited to have them here. I have a lot of appreciation for what they do and who they are. And if you don't know who Emergency Feeding Program is, you're going to find out today. Again, my guests, Belinda Dunbar and Mr. Glenn Turner. How are the both of you? I guess I'll just so that you don't have to fight over who goes first. Belinda, how are you?
I'm doing well. Thank you. Thank you for having me. How are you?
Under the circumstances, fantastic. And Mr. Turner, good to see you again. How are you doing, my man?
I'm doing well. We're moving forward here, and we're just trying to keep our head up and keep grinding, making sure that people in our community are fed.
Well, as a lot of things have taken the forefront of the media. Initially, when this happened, there was a lot of media regarding the fact that, folks, there was no food, and it interrupted the whole process of where folks were at in regarding to eating. Just even if you're starting out, kids didn't go to school, and that's where they got their meals from. And we're hearing a lot about other things now, but I'm pretty sure that you can attest to this. Hunger didn't stop, even though the Delta variant began to grow and began to take up the hunger did not stop. So for anyone who's unfamiliar with the emergency feeding program, Glenn or Belinda, let's start and let's share information about who you are for people who may not know it. Not everyone uses your services, but you have a great impact in our community. And so for folks who don't know who you are, let's tell them about the emergency feeding program.
Okay, so the emergency feeding program was started in 1977. We have been around now for 44 years. We provide food to 3 different counties in the along the I-5 corridor, which is Snohomish, King, and Pierce County. Last year, we did nearly 4 million pounds of food during the height of the pandemic. And that's our job. We're like the Marines. We're in first. We make sure that we take care of the areas and people that we need to. And, we try not to, be that type of organization that's always standing there with our hand out for something. We always want to be the organization to provide that hand up to folks out in the community.
And Glenn, you're going to get an opportunity to answer this question too, but you'll have some time to think about it. Belinda, first I'll address this question to you. Why are you engaged, and do you do the type of work that you are doing with the emergency feeding program?
Oh, well, I come from a long range of families that have always helped out, whether it was nonprofit or not. And one of the mantras that I always remembered from my grandmother was, if you can't help them,
If there's a way you can get closer to the mic so that we can hear you a little bit better, because if we turn it up on this end, it's going to pick up a lot of sound.
How about now? Can you hear me?
That's a lot better.
Yeah, I just come from a family that believes in helping out in the community and helping those that are less fortunate. You never know when that turn is going to be yours. Also, I believe that if you can't help them, don't hurt them. And so when I came to the emergency feeding program and realized what they were doing, I was asked to put intake cards into the computer. Intake cards are people that receive food from the different agencies that we provide the food bags to. And just looking at some of the stories that were on the intake card, it just got me to thinking, hey, I can help out here. And so I'm glad to do so. 8 years later, still going.
All right. Well, thank you for the work that you do. Glenn, same question to you. Why did you choose to do this type of work?
Well, I guess, the reality of it is I didn't choose to do this work. I was offered this job 3 times, and 3 times I turned it down. My life was surrounded in sports. I was a basketball coach. I ran a nonprofit called Youth Education and Sports. So this was nowhere on my radar, but, I started thinking back to when I was a child and how my parents and my family depended on food banks as a source of food for our families. And, that kind of swayed me. It made me realize that, I came from the same group. So I should be trying to do something to help support our communities and, help folks to get fed and, just provide whatever service I can to our community.
And y'all have a fundraiser coming up, which I'm excited to talk about so that folks can give back to you. But I want to get a little bit more in depth of what it takes to run an operation like this. It just doesn't happen magically. It does for the folks who need your services. They get to show up. But let's talk about the infrastructure that has to be in place to make this happen. Transportation, all of the things that go into delivering the services, and not the least of which is being able to provide the food that you do have, the gathering of that. And I know, Belinda, that's an area that you're engaged and involved in creating those resources. But for both of you, I don't know where to start. Whichever one of you wants to go ahead and dig in on this. How do you make this happen?
Well, I'll jump in first. We are a nonprofit. And for those of you that understand what nonprofits are, we don't just get things handed out. We have to work. We have to get out there and knock on doors and make phone calls and, create opportunities for this organization to open doors every day. We have great partnerships that we've developed throughout the years since I've been here. And a lot of it is just making sure that, we can be accountable for the resources that are provided to us. And by being accountable, it helped us actually grow, expand, and be able to cover more ground and serve more people in the community. But it's not, it's a hard job. Like I tell everybody, when I started here, I was, all my hair was black. I was completely, that was a little over 8 years ago. And in that short period of time, you can see I look like like Moses now. So, it's just being committed to the cause, being committed to the fact that there's always been people that needed help, and we've always taken it from the standpoint that we didn't choose this, we were assigned to it. And my staff right now is very dedicated. We work hard. We continue to look for partnerships. We continue to look for different funding to help support these communities in which we serve. So, it's challenging, but more than anything else, it's more rewarding. So,
and Belinda, feel free to jump in on this. I mean, we were watching video, and we saw, you know, the things that were necessary as you're watching this. I forget what those things are called, but they're what are those things called that lift heavy things up? And
forklifts.
forklifts. Yes, there you go. And trucks, you know, parts and stuff rolling off the trucks. You're taking food from one place to another. You're picking up food. Again, looking at the infrastructure of what it takes to make this happen. Belinda, I'd like to get your thoughts on this. Again, this well-oiled machine. You know, at least from our perspective, that's what we see on making this happen to take care of our communities.
It takes a lot of work. It takes a lot of dedication. You're going back and forth to the table. One thing that I'm really good at is following up. And so I believe in if I reach out to an organization looking for a grant and they tell me no, I don't take it personally. I just use that mantra as next opportunity. And a lot of times they come back to me and say, hey, you know, we have an opportunity now for you to apply. So I try and build relationships with everyone that I encounter and talk to them about. I invite them to come to the facility to see what we're doing. It's one thing to share it on a computer. It's another thing to actually come to the facility and see how it's ran, like follow the food, see how it's prepared in the morning, see how it's packaged, and watch it go out on the truck. The favorite part of my day here is when the trucks leave the facility, taking the food to the different communities, because I know that people have been waiting there since about 6 in the morning. I do grant writing, and so I've made a lot of partnerships and friendships with people. And some of them let me know, well, not now, but I have something coming later up the pipeline. Looking for grants is like looking for a diamond in a haystack. It's far few and in between. A lot of the funders have changed their attention to technology, which is fine. But we both know that hunger is still alive and present. It has no face, no race, no religion. Hunger is hunger. So you just have to keep scratching at it until you come upon the right one. And so a lot of times you can write the best grant and still not be rewarded. So what I do is try to think of other events that we can do to bring money into the program while we wait on the grants to come in. So every day is a new challenge, and we're up for it.
All right, and one of these would be the fundraiser. Now, I've not heard of you having a fundraiser before.
Oh, we've had plenty of them here.
So that's good. So what I'm going to do at this point in time, because I didn't ask you about this in advance, because I wanted to hear from you like everybody else. Yeah. Now, in this particular industry that I'm in, we call this shameless self-promotion. All right. So what I want y'all to do right now is some shameless. Don't be shamed. All right. Don't be shamed. Promote what you were doing. Tell us all about it. I'm going to move my microphone away because I'm not going to interrupt you. And I want you to tell me and everybody else everything about this fundraiser that we need to know. And I'll pick the microphone back up and ask questions if I had to. All right. But this is your opportunity. And I know that a lot of times you're so busy doing the work that you do that you don't promote the work that you do. So let's just call this an exercise if we need to. I'm going to move my microphone away. Give us everything we need to know about this fundraiser. All right? Don't be ashamed.
Absolutely. Yeah. Thank you so much, Tony. We are going to have what's called a casino night fundraiser. Now, this is a cashless event. Everything will be done through a credit card. There's a buy-in of $50. That's kind of like your entry fee. And we're just going to have entertainment. We're going to have food. We're going to have games. We're going to have a silent auction. We'll have a live auction. We just want to create a really fun opportunity for folks to come out and just kind of change the pace of things. You know, with COVID, a lot of organizations that are in the nonprofit world kind of went to virtual fundraising. Well, we think there's a little window of opportunity here for us to gather people together and just come out and have some fun. You know, we'll have Josephine Howe as our lead performer. We'll have DJ Trias, who's from California, who's going to come up and spin the wheels for us. So there'll be dancing, there'll be food, there'll be gambling. And then, you know, there'll be opportunities to create some other entertainment along the way. Belinda set up a women's business meeting. So prior to the engagement, they'll sit around the round table and talk about things in our community that help support programs such as ours, you know, and, you know, we want people to get in the game. We want people to understand that, you know, we have to work together to make things better. And, you know, we know there's a lot of nonprofits out there. We know there's a lot of fundraisers going on out there. But, you know, we are a basic essential organization. You know, without food, you can't live. So we want to make sure that if you have the food, then you can move on to the next thing is you know, working through a healthy environment to be able to create other endeavors around the community. We don't, you know, look at standing on the top of anything. We just look at wanting to be a part of everything. And if we can help to support other organizations through this, we're going to support other organizations through this. You know, we work with Northwest Harvest, we work with Food Lifeline, we work with United Way, we work with all these organizations to be almost a transport, in for lack of a better term, of a lot of food that goes out in this community. And, you know, to be able to do that, we have to be able to raise money.
Now, see, I'm going to put the emphasis back on you, all right? Because this is shameless self-promotion. Right. Tell us when, where, how we can get involved, what we need to do, how folks can give.
Yes.
When is it? When is it?
Okay. The fundraiser is Friday, October 8th, 2020. It starts at 7 p.m. It's over at 11. Our address is 851 Hauser Way North, Renton, 98057. And to get in contact with us, you can call our office at 425-277-0300. Here and ready.
Is there pre-registration that folks can do?
They can do pre-registration. If they get the flyer, there is a code on there. They can take their phone and just scan it right there. It will direct them right to our website, and they can go online and pre-register right there on our website.
Okay, I'm going to recommend that folks pre-register.
Yes,
so
pre-register.
Pre-register. If you need to creep up on the day, you can do that too. Yes. So, but again, we're talking about emergency feeding program, the 44th, and I didn't even know. You know what I mean? So I'm embarrassed by that. But the 44th. So again, to pre-register, how do you get down? What do you do? One more again.
Okay, you can call the emergency feeding program at area code 425-277-0300, or you can go to our website and you can log in right there, and there's a code on there. You can scan your phone, just click the donate button and go ahead and follow the prompts there, your name and so forth, and pay your $50 to go to the casino. And so we know that it'll be for casino night. It's really easy. It's going to be a lot of fun, a lot of people here, a lot of partnerships will come out of this, and new friendships will be made. So you never know.
So, and let me say this, Tony, your $50 is really a donation to the organization, yes. But you will get chips to play at the gaming tables that we'll have at the casino. Right. We'll have several different gaming tables you can play at. At each table, there will be an ultimate prize that you can win, but there will also be prizes that you can win along the way. You know, whoever wins the most chips at the table, if you get a certain, you know, type of winning hand, there'll be gifts given out at that point. And it's just going to be an opportunity for folks to come out, have some fun, folks come out, share with us in this event, and learn more about the emergency feeding program. We are a fantastic organization. You know, I'm kind of patting ourselves on the back right now, but it's true. We've been around for 44 years. We've kind of been doing things from the back room. You know, not a lot of people, as you mentioned earlier, know about us, but we provide so much in this community, and we just know that now it's time for us to just come out. The curtain has to open, and they have to see who we are, because we are essential in this organization. We are essential in this community. We provide, like I said, from Snohomish County down to Pierce County, and we hit those places that are impacted the most, that can't take the giant bulk food. We give them good, solid, healthy diet food. You know, one of our biggest suppliers is Amazon. So we are giving them natural-based food. We're giving them food that will help them to, you know, avoid some of the illnesses that are contracted through food. And, you know, we want to make people aware of that through this through this opportunity to fundraise for the organization.
And you are a Black-owned business, is that correct?
We are Black-owned, from top to bottom.
And the only Black-owned food distribution service in the state? Yes.
Yeah.
All right. And so again, folks can also walk up day of, correct?
Yes, sir.
Yes, they can.
It is an open event.
Now, are there requirements? Do folks have to show a vaccination card? Do they have to show proof of being a test that's negative? Are you taking temperatures at the door? Again, this is the impact of the coronavirus show. And so are the precautions that you are taking that folks should be aware of before they show up, anticipating that they may not have to do that?
Yes, we will be taking temperatures at the door. If you have a vaccination card, bring a vaccination. If masks are required. If you have a current test, bring that with you, showing that you are negative. But we are taking the precautions that are necessary to make sure that this event is eventful yet uneventful. So, we want to make sure everybody's safe and everybody comes in and has a great time.
Now, if you spend all of your chips, you can go back and buy more chips. Can you do that?
Yes, sir.
And so if you're a lousy poker player, now's the time to play.
Come on. Come on. Whatever game you're lousy at, come on and play.
Come on and play. And if you're playing blackjack, go ahead and hit on 19, double down on 20, and lose your money and go get some more chips. We just risk it all. That's why we're going to play, right? Risk it all.
That's right. Because you know what? The funds will roll right back into the community.
That's what I'm talking about.
Absolutely.
So we want to make sure that you come, you have a great time, and you know that whatever you are donating to this organization is going to serve the purpose of helping to feed folks in this community.
So come on out, have some fun. And in this one particular instance, I'm with the house. This time we're with the house. All right, we're with the house to win. So come on out, spend some money, have a good time. If you've never played poker before, this is your chance to lose for fun.
That's right.
Donate to a great cause. Again, the address and information about how people can participate, the when, where, how.
It is the Emergency Feeding Program. The address is 851 North Hauser Way, Renton 98057. Our telephone number is 425-277-0300. Give us a call. We're ready to answer your questions. We're looking forward to this event and having some fun. All proceeds go to the Emergency Feeding Program. Help us help those that are in need.
All right. And I appreciate the work that y'all do. Almost out of time here, but I want to give you both an opportunity for final words.
Thank you.
I would just like to say, as we spoke about earlier, we've been around for 44 years. We've kind of been in the back room, the back shed, doing the work that, most people were looking for the biggest visibility from. But I think, from my upbringing, it's not the work that you do to get all the support or the recognition from. You do it so that you're helping folks. You're making sure that your neighbor has food to eat the next day. You're making sure that the kids have clothing that they can be given through your efforts in the community, going around saying we're doing just a little coat drive for the kids in the neighborhood today. We're doing that for the homeless right now. We have a SOS program where we're feeding in 9 different locations around King and Snohomish County, or King and Pierce County. And we go to the streets to do it. You might see our EFP van rolling around the community. Well, that's our van that we take out to support our SOS program. We have very healthy and substantial food that we provide to those that are most in need. And we're going to do whatever we need to make sure that everybody can go to sleep with a full belly tonight. That's our goal, is to make sure no one goes without a meal today. And if you received our address that Belinda just gave you a few minutes ago, you're welcome to come down here, knock on our door, and say, hey, my family needs some help. We're always willing to do what we need to do to make sure that we're taking care of people.
You know, and I didn't focus on that this time. Every other time we have focused on that, and I'm glad that you made sure that that's why you exist. I just wanted to tell folks who you were and get folks to come down to the fundraiser. But yes, you feed people. You make it very comfortable for folks to come down and get something to eat, and a lot of times that's a dignity issue, and y'all handle that so well. Belinda, I didn't give you your chance for final words yet.
Well, my final words is we're going to continue to do what our mission and vision statement is, to ensure no one goes hungry and providing nutritious meal to the families out there, those experiencing hunger. That's what we do, point blank. And we do it with dignity. And if there's resources we can provide to them, we do that as well. But our main goal is to make sure that they're fed. Like I said, hunger doesn't have a face.
So one last thing, if I might, Tony, we do have a kind of a compacted clothing drive as well. So we bring clothes in. So when we do go out with our SOS program, we provide clothing to folks out there in those communities too. We work with World Vision. We get tents, we get air mattresses, things of that nature that we help to provide to those people in that community as well. So, you know, we're just trying to hit every aspect of trying to get those that are, you know, struggling right now, as you mentioned earlier, some dignity. You know, we let them come and shop. We don't just hand them a bag of food. We go out and we lay stuff out like you're going to the grocery store, and you shop for what you need.
Shop till you drop.
That's right. Shop till you drop. We're there for you.
Is there a way to participate virtually for folks who may have reasons that they don't want to actually come out but want to participate? You know, is there a way to participate virtually this year?
You know, we are looking right now. It's just about making a donation, a contribution.
Yeah.
Virtually, our resources don't afford us at this time to set something up, and we're a little bit too close in the game. We have spoken about that, but we want to take this opportunity to say, if you want to support us, you know, please do so. You can scan the barcode, or you can reach out to us through our website, emergencyfeedingprogram.org. and support the program through that process.
All right.
If
Well,
they have any problems, they can call me. I will walk them through the website. It's very easy, but I understand sometimes there are challenges. So just come out and support us any way you can. We're here in the community. We're not going anywhere, and our goal is to help those that are in need.
all right. Well, if you're not going to be in town that weekend, like me, you can still donate and let the chips fall where they may. And so that is one way to do it. And this is impromptu, but let's talk so that next year, because this is what we do. Yes. I would love to cover this event live while we're there, and then provide ways digitally for folks to actually participate. And we can put that, we can work with you and make that happen for you, so that all you got to do is worry about what you're doing. But let's it's a little short this year, but we can do that next year. That way folks who can't make it there can still have a way of participating and playing, and they'll just do it virtually, and we'll make that happen too. So
sounds good. Thank you.
All right. Well, best of luck to you. I'm sorry?
Can I plug one more event?
Oh, sure.
We're going to have an NFL Sunday, December 5th. We're going to feature the Seahawks game, but we'll open our doors at 1 p.m. to catch the pre-games to that. But it's going to be set up just like a Hawk's Nest, basically, where people can come in. You know, we'll have food, we'll have drink, we'll have opportunities to play some games and things of that nature. We'll have 5 or 6 screens around our warehouse. So we're just going to open it up and allow that to be an event that people can come to. And obviously the safety standards are the same. You know, we'll look for masks, we'll look for your vaccines, we'll look for your test results, and we'll make sure that everybody's in a safe and healthy environment at that point. But that's going to be open too, and that's open to the general public as well.
All right. Go donate, whether you're going to be here or not. You can donate. Do that. If you're going, have a great time. Lose. Okay.
As much as you possibly can.
lose as much as you can. And thank you for the work that you do.
For a good purpose, yes.
Thank you, Tony.
I'm glad we were able to make this happen. So again, I'm not going to be able to make it, but I'm still going to donate, and I'm encouraging others out there who can't make it to donate as well. Appreciate y'all.
Perfect. We'll talk soon.
All right. For those of you who are on our visual formats, going to ask you to change over to our audio formats. A number of ways to listen. We'll continue the discussions on the impacts of the coronavirus on South Seattle and surrounding